How you doing, guys? Thanks for joining us today. I'm Dr. Kevin Merishaw of Strength and Nu-Therapy. I'm here with Steve, and we're going to go through our March Madness segment today. Basically, we're going to talk about jumper's knee, which is a really common injury, not only with basketball, with any elevating type of loading, sports, or exercises. A lot of you are going to be watching March Madness, going to get that urge to want to play basketball, so those old nagging injuries are going to come back and just haunt you. So today we're going to go over some tips on how to better manage and deal with jumper's knee. Just a little tutorial right here really quick. Jumper's knee basically is what is known as patellar tendonitis, where this muscle right here, your rectus femoris, vastus medialis, and vastus lateralis make up the quad muscle, turn into one tendon and attach here on the tibial tuberosity. What happens is there's a lot of friction that happens right here at this shortened segment, and that's where that inflammation and pain starts to build up in, and then it'll become more of a global or widespread pain over the knee. So today we're going to be going over 3 tips to help you better manage your jumper's knee and get you back to loading, jump into that rim like you want to. All right, so we're going to come over here. We're going to start off with some ankle mobility. What we want to really stress is that whatever's going on at the knee, you want to address the ankle and you want to address the hip, because the knee is the joint that's going to take on all of the stress between those 2 joints. All right? So what we have Steve doing here is working on his ankle mobility. So what he has is his foot really close to the wall, and he's going to progressively step back. And what he's doing is he's going into dorsiflexion, or bringing his toes closer to his shin in order to increase the range of motion down here at the ankle joint. That's going to help Steve a lot with his loading and minimize the stress that's going on at the knee. How does that feel, Steve?
Excellent.
Is that all right? Okay. Come on over. What we're going to be working on next is single leg glute extensions. What this is going to do is going to help Steve with his elevation and his explosiveness, minimizing the stress going on at the knee. So we're going to have Steve do here is he's going to have his chest nice and high, core nice and braced, one leg up, and this is going to be a single leg extension, right? So what Steve is doing is he's going to be exploding through this glute right here, nice and controlled, chest up, don't collapse. Good. And nice and slowly controlled down. Good. Okay, we're going to do that one more time, chest up nice and high, core tight. We're going to elevate from the, there we go, and slowly down. Good. Okay, go ahead and relax. Another thing we like to focus on here at Strength and Nu-Therapy is we like to do a lot of asymmetric or one-sided type workouts, because that will allow us to expose one side over the other so that the stronger side might not be compensated for what's going on with the weaker side. Right? Next exercise we're going to be doing is a Bulgarian Split squat. Right? One thing we're going to add to the Bulgarian Split squat is a resistance band. And what this is going to do is going to help with a counterbalance at Steve's knee, because what happens a lot with split lunges or squats is a lot of people will stress over the front of their toes. Okay, so get you to step in there. Good. Get you to step back a little bit more. Perfect. So Steve's going to have his chest nice and high, core nice and braced, and all of the stress is going to be in the quad and hamstring complex until he gets to a certain point, and then it's going to be predominantly glute max. So again, as you see, Steve's able to sit back and is not leaning forward over that knee. Perfect. And relax. A couple of modifications we can make to this is raising these stacked blocks so that Steve has more of a progression going downwards. I'm going to step over here from Steve. And another progression we can make with the single leg extensions is we can drop the block so that Steve's starting at a lower point and has to go through more glute extension to get up. Right? How'd that feel, Steve? Good?
It's good. It's good.
All right, guys, those are some quick tips to help you deal and better prevent jumper's knee. You basically want to be able to get in contact with a healthcare practitioner to actually go through some of the musculature around the quad muscle, because if there's a lot of dysfunction and adhesion in those muscles, your recovery through these exercises is going to be slowed down. So that's something that you might want to look into. If you have any questions, drop by anytime and ask us all the questions you need. Enjoy March Madness, guys.